All right, good afternoon, everybody. My name is Trenton Howard. I'm the Human Resources Manager, and I will be going through bloodborne pathogen, fire extinguisher, asbestos, and then also lockout, tagout for you guys today. So the first one we're going to go over is the bloodborne pathogen. So the goals for today, the first is to heighten your awareness that bloodborne diseases are a potential job hazard. This is a requirement from OSHA. We're also going to discuss ways to protect yourself from exposure, and then also discuss general disease control best practices. So first what we're going to talk about is what is a bloodborne pathogen. So a bloodborne pathogen is a microscopic organism that can cause diseases. Bloodborne means the pathogen is carried within the blood. These pathogens can also cause serious and life-threatening illnesses, and includes but is not limited to hepatitis B and C, as well as HIV. So other types, and just think of it this way. So bloodborne pathogens, the main focus point today is going to be hepatitis B, C, and then also A. So the word hepatitis, that's going to refer to the kidneys, all right? Basically, infections of the kidneys can cause complete failure. So hepatitis B, it causes inflammation and damage to the liver. Hepatitis C is the most common chronic bloodborne infection and the number one cause of liver transplants. And then also HIV. So there are vaccinations against these diseases for hepatitis B. It's a series of 3 vaccinations over a period of 6 months. Fortunately, nowadays, you can get that for free as long as you do have health insurance. So you can go to a lot of different care providers, also Walgreens, Rite Aid, you name it, any place that does offer those vaccinations. I strongly encourage you to, especially with the clients that we work with here. It is very important to have that if you have not had those vaccinations, because you could be exposed to bites, other potentially infectious material, which we'll discuss a little bit later. So hepatitis B does present the greatest risk. It's the most prevalent in the population. U.S. estimates are for 3,000 new cases in 2016. It's also 100 times more infectious than HIV as well. So it's a big issue. And then also it can provide, so the vaccination can provide immunity in over 95% of recipients. And if it, worst case scenario for if you do have hepatitis B, it can become chronic about 5 to 10% of the time. So if you think you've been exposed to the hepatitis B virus, what should you do? If you're concerned that you might have been exposed to hepatitis B virus, call your doctor or health department. If someone who has been exposed to hepatitis B virus gets the vaccine within 24 hours, you have a very strong chance that you can prevent developing hepatitis B. So that's why the vaccinations is so important. Usually you get that at a very young age, but also in adulthood you can get that as well. So there's really no time frame of when you should, but typically, most commonly, people get the hepatitis B vaccinations when they're much younger. So one of the reasons why we talk about hepatitis, because it can survive outside of the body. Now, there's a difference between the longevity between hepatitis B and C. So hepatitis B can survive outside the body for at least 7 days. During that time, the virus is still capable of causing infection. So how should you be cleaning up blood spills from the surfaces if you do see blood? So all blood spills, including those that have already been dried, should be cleaned and disinfected with a mixture of bleach and water. So 1 part household bleach to 10 parts water. If you don't really know what that looks like, you can also talk to the maintenance department. We have custodians and the technicians that would probably be able to help assist. And regardless, even if you clean it yourself, I would strongly encourage you to talk to the maintenance department to make sure that they are aware of the situation and they can just assess it and also do some extra cleaning that they have access to as well, like for stronger chemicals. Also, make sure that gloves should always be used when cleaning up any blood spills, and we'll talk about how to use the proper gloves and how the proper way of putting on gloves here in a little bit. And really important to note too that even dry blood can be infectious. So regardless, if you're walking on campus and you see dry blood anywhere, in the building, outside the building, always assume that it's infectious. So make sure that you clean that up properly, have the appropriate gloves. So always treat every blood spill, every potentially infectious material as such. So make sure that you keep people away from them. Make sure that you're not touching it. Don't just assume that it's been 3 weeks or 2 weeks or what have you. You just don't know. So always be cautious. So there are different concentration levels of hepatitis B within the body. So on the screen you can see the high levels would be concentration would be from blood, serum, wound fluids. Moderate amount would be semen, vaginal fluid, and saliva. And then low but not detectable concentration of hepatitis B within the body can be urine, feces, sweat, tears, as well as breast milk. So transmission of hepatitis B, there's a variety of ways that people can come into contact with hepatitis B virus. First one could be birth, so spread from an infected mother to her baby during birth. Sex with an infected partner, sharing needles, syringes, or drug preparation equipment. Sharing items such as toothbrushes, razors, medical equipment, such as a glucose monitor with an infected person. That's usually when people that with diabetes, if they prick their finger, that's kind of what they're referring to. Direct contact with the blood or open sores of an infected person, and then also exposure to blood from needle sticks or other sharp objects of an infected person. So hepatitis C, so 2.4 million people that have hepatitis C have developed chronic symptoms. So it's a very similar transmission route, very similar to hepatitis B. A high incident rate, so people that come in contact, 75 to 85% of them, it can become chronic, but then also 10 to 20% of the cases can lead to cirrhosis, which is complete liver failure. Now, as opposed to hepatitis B, which survives 7 days outside the body, this can survive 3 weeks. So that's much longer, a lot more riskier as well. So again, I can't stress the importance of cleaning up any potentially infectious material like blood spills right away. There are no vaccinations for hepatitis C, but treatments are improving. So HIV and AIDS, so HIV is a virus spread through certain body fluids that attacks the body's immune system, specifically the CD4 cells, often called T cells. So over time, HIV can destroy so many of these cells that the body can't fight off infections and disease. This damage to the immune system does make it harder and harder for the body to fight off infections and some other diseases. So HIV and AIDS, it is pretty difficult to catch occupationally, has a very low incident rate in the US. Someone that is diagnosed with HIV and treated before the disease is far advanced can live nearly as long as someone who does not have HIV. There is no cure, but can be managed fairly well if infected. So what if you get exposed to blood or body fluid on the job? So first and foremost, wash the area with soap and water immediately. One of the things I like to tell staff is, let's say if you get a cut on your finger, and you're potentially exposed to infectious material. So the first thing you want to do is kind of like imagine squeezing toothpaste, right? Like you're about ready to run out of toothpaste and you're trying to squeeze out the last bit as you can. So you start from the base, like let's pretend like the finger is the toothpaste tube. So you squeeze at the base and you squeeze outward towards that open wound. That will squeeze out the blood, so that will have some of that material, potentially infectious material in there, while you're under the water, while the finger's under the water. Make sure that you rinse that out thoroughly. Then apply the soap and water, and then continue to wash appropriately. And we'll get to how to wash your hands appropriately as well. Next, you can also apply sanitizer if no soap or water is available. Get first aid as needed, Report the incident to your supervisor, seek medical attention if appropriate, and then also follow physician orders if applicable. So OPIM, which is the acronym for Other Potentially Infectious Material, which is what I was referring to in the previous slides. So that also can include not just blood, but human blood components and or products, semen, vaginal secretions, cerebral spinal fluid, synovial fluid, pleural fluid, pericardial fluid, peritoneal fluid. I'm really testing my medical knowledge. Amniotic fluid, saliva and dental procedures, any body fluid that is visibly contaminated with blood, and then any fluids in which differentiation of body fluid types is difficult or impossible. So what exactly is an exposure? So potentially infectious blood or body fluid coming into contact with non-intact skin. It can also be considered poking, puncturing skin surface, such as a needle stick, with a contaminated object. Potentially infectious body fluid coming into contact with mucous membranes, so eyes, nose, mouth, vagina, rectum. So for residential counselors, you're going to be filling out some forms that say, was it an incident or exposure? So a lot of times, you guys do a really good job doing that. Sometimes it's really, some people will select an exposure when it actually was just an incident. So for example, a client gets a bloody nose and wipes the nose with a tissue and throws it away. That would be considered an incident because no one else was exposed to that potentially infectious material. It was in a contained area. Now let's say if that client sneezed with a bloody nose and the blood particles got into a staff member's face, potentially in the eye, then you would circle exposure as well. So just make sure that you circle the correct one and then also understand the difference between the two. So how can you protect yourself from these diseases? So first of all, avoid direct contact with blood or body fluids. Put a barrier between you and the body fluid. So gloves, glasses, CPR shield. Wash your hands thoroughly and often. Use hand sanitizer if no soap and water is available. So for gloves, so imagine that you're putting on gloves and then you're cleaning up potentially infectious material. So the first thing you want to do, and it's kind of hard to show, but you grab the base of your hand with the glove. The glove, you do not touch your skin. You should not be touching your skin with any potentially infectious material at all. So you grab the base of the glove, which should be located on the wrist. You pinch it, and then you roll off the glove on your hand. Then with the glove that's on your other hand, holding the inside out glove, you roll that in a ball with your hand, and then with the non-glove hand that does not have any infectious material, you will slide it underneath the other glove on the other hand and roll that off. So both of those gloves should be inside out. You should not be touching your skin whatsoever. Once you dispose of the gloves, make sure that it is in the red bin, which is the biohazard bin as well. So washing your hands thoroughly and often, as I mentioned before, there is a proper way of doing that. Make sure that you run your hands under water first, then you lather on soap. Sing happy birthday twice or the alphabet twice. Basically, as long as it's 20 seconds that you're washing your hands thoroughly, getting underneath the fingernails, making sure that once you're done washing your hands, that you're not touching the faucet. If it's not an automatic sink, to make sure that you're grab a paper towel and then shut off the water, so that way you're not touching that surface area. Because I guarantee, if people are not washing their hands thoroughly, that there could be potentially infectious material on top of those levers. And then what I would do, just for an extra safe precaution, just grab an extra paper towel, and then right before you leave the room, use the handle with touch the handle with the paper towel, not your actual hand, so that way you don't get other potentially infectious material as a just in case. So for OSHA, they kind of describe the chain of transmission kind of like the chain that is attached to swings at a park. So imagine one of those chains that's holding up the seat, one of those the swings. Imagine that that's the chain of transmission. So what they're saying is that you just need to break one link in the chain to eliminate an exposure. So here is the chain of events. So it starts with a pathogen, then it goes to a host or source, and that source or host has an exit route, which is a mode of transmission. Then there's an entry route, and then also a susceptible host, and on it goes. So again, universal precautions to breaking the chain, so making sure that you have the proper PPEs, hand washing, good hygiene practices, using mouthpieces and resuscitation bags to prevent exposure to potentially infectious saliva during CPR, cleaning the surfaces as soon as possible after contamination. Okay, we talked about that. Then every agency should have an exposure control plan. So hepatitis B vaccination and post-exposure, communication and training, which is what we're doing now, record keeping of that training. So we do this on an annual basis. Then also confidentiality as well. So if there is exposure, just know that it's only on a need-to-know basis and only going to be discussed within authorized individuals. There are methods of compliance. So making sure, again, universal precautions. I said this before, but treat all blood and certain human body fluids as if they are infectious for HIV, HPV, and other bloodborne pathogens. And then also for engineering control, isolate or remove the hazard. So if you yourself are not in a place where you can grab materials to clean that up right away, every staff that work with the clients should have a radio. So radio the maintenance team, let them know what needs to be taken care of, where it's at, and then they will handle that accordingly, and then also provide the appropriate PPEs and the correct materials to kind of wall off, so that way other clients are not going to be exposed to that as well. So again, work practice control, so hand washing, flushing the mucous membranes after contact, personal protective equipment, so gloves, gowns, lavatory coats, you name it. And then for contaminated items, just make sure that the items caked with dried blood or opium are capable of releasing these materials during handling. So really handle with care. Also with the same with contaminated sharps. So this all should be in the biohazard bin. So it should be the red bin located in your cottages. Again, the hepatitis B vaccination can't encourage it enough, but definitely if you're not vaccinated with the hepatitis B, so just make sure that you do get your vaccinations. And so again, it's free to people that have health insurance. So again, you can be at a care provider, could be at Rite Aid, Walgreens, you name it. Okay, talked about that. Other diseases of concern in densely populated environments, so things to think about is influenza, the Norwalk virus, hepatitis A, common cold. So flu, influenza, you're very familiar with that. Can't survive on surfaces for hours. The transmission can be surface contact or droplets. Symptoms can include fever, headache, extreme tiredness, dry cough, sore throat. So for the norovirus, basically known as Norwalk virus or the cruise ship virus, that is actually can be caused through due to fecal, so oral to fecal route. So the reason why they call the cruise ship virus, imagine you're in a cruise ship, you're with people for 7 days. Granted, the hotel rooms might have their own bathrooms, but there's also public restrooms as well. So if people are not washing their hands thoroughly after going to the bathroom and then touching high surface areas such as doorknobs, sink faucets, even the buffet lines, touching the utensils, or maybe kids just grabbing food, that is usually why it's called the cruise ship virus. It's really gross. So just make sure that I encourage you, when you wash your hands, that when you turn off the faucets, use paper towels. When you open up the doors to get out of the restrooms, use paper towels, not your hands, especially to avoid something like this that can be easily prevented. Now, hepatitis A, let's see, hepatitis A could actually be through the fecal-oral route as well, very similar to the Norwalk virus. There is vaccinations for hepatitis A as well, so if you're not vaccinated, again, make sure you get vaccinated. And then last couple things, so if exposed, actually getting the disease really depends on the infectivity of the bug, the concentration of the bug, the duration of the exposure, and susceptibility, so immune status. So if you're immunocompromised, you can be susceptible as well. So lastly, I'll close with this. Other things to think about: bathroom door handles and faucets. Flipping through stacks of paperwork. I don't know if you've met people that would lick their fingers to sift through paper, but that can be a thing too. So, be cautious of that. Then also bar soap. I haven't really seen any organizations that have bar soaps for for the public, and if you do see one, I would definitely avoid that. I don't know about you, but I tend to avoid bar soaps. I will use any other soaps but bar soaps, because it is kind of gross, and you're kind of hoping that other people have clean hands too when they're touching the bar soap. And then also touching your face, mouth, eyes, and food, but that is just a general thing as well. All right, perfect. Well, that concludes the bloodborne pathogens. If you have any questions moving forward, feel free to reach out to me. My email is thoward@stmary's.homeforboys.org. And then also my phone number is 503-259-3103. Thank you for attending.